Hi there. Today we're talking about a critical topic: first aid for stroke. Knowing what to do in those first crucial moments can save a life and reduce long-term disability. If you or someone else is having a stroke, the very first step is to call emergency medical services. Quick treatment can make a huge difference. Here's what you need to do if you think someone is having a stroke. Step 1. Call emergency services. Recognize stroke symptoms like face drooping, arm weakness, and speech difficulty. If you notice any of these, call 911 or your local emergency services immediately. Stay as calm as possible while you wait for help. Step 2. Get them in a safe position. If you're with someone having a stroke, ensure they're safe and comfortable. If possible, lay them on one side with their head slightly raised and supported. This position can help if they vomit. Step 3. Check their breathing. If they're not breathing, perform chest compressions or CPR. If they're having trouble breathing, loosen any tight clothing like a tie or scarf. Step 4. Check for bleeding. If they've fallen and are bleeding, apply pressure to the wound with a clean cloth. Step 5. Observe and communicate. Watch the person carefully for any changes. Be ready to tell the emergency operator about your symptoms and when they started. Mention if they fell or hit their head. Talk to the person calmly and reassuringly. Important: don't give them anything to eat or drink to prevent choking. First aid and stroke recovery. After first aid and treatment, the recovery process can vary. It starts with acute care in the hospital to assess and stabilize the condition, usually lasting about a week. Rehabilitation follows, which could be inpatient or outpatient, depending on the severity of the stroke. Rehabilitation aims to strengthen motor skills, improve mobility, and reduce muscle tension. This might include speech and language therapy, depending on the symptoms. Getting prompt emergency medical care can significantly reduce the risk of disability following a stroke. The American Stroke Association recommends calling an ambulance rather than driving the person to the hospital. This way, they receive critical care en route. Remember, after contacting emergency services, make the person safe and provide first aid if needed until help arrives. Quick treatment can expand the options available for medical professionals to treat the stroke. Thanks for watching. Stay informed and prepared. It could save a life. Don't forget to like, comment, and subscribe for more essential health tips.